I'm a senior consultant, pediatric pulmonologist at Fortis Memorial Research Institute, Gurgaon. At Fortis, we have a dedicated division of pediatric pulmonology, which is only looking after chest problems in children. We are catering to children right from the newborn age right up to adolescents. This is, one specialty which is not in many centers, at least not in the private sector. So there we have a USP. So we get a lot of referrals, small babies who are coming with breathing issues, which are related to congenital anomalies. So they are referred for bronchoscopies. We do bronchoscopies right from preterm babies to term babies and older ones also. Then at a slightly older age, we get a lot of referrals for children who suddenly start developing breathing issues and noisy breathings which are related to foreign body aspirations, which are so common in the pediatric age group. So we localize it, and we have got all the backup and all the equipment to immediately remove it. Even with the flexible bronchoscopy, and if it is not possible or flexible, then we even have rigid bronchoscopies, and we take it out with that. Then bronchoscopies are done to diagnose pneumonias which are not responding to the usual line of treatment. So that again unmasks a lot of rare conditions which are not usually diagnosed routinely. So as a follow-up of that question, I would like to say that we have a cystic fibrosis clinic. Again, we have patients coming as pneumonias who are not getting fine, or as children who are not growing well, as failure to thrives. So we work them up, and many of them land up with rare diagnosis like cystic fibrosis, and we have a dedicated cystic fibrosis clinic and a good cystic fibrosis group. So these children who have inherited problems and who are managed well and diagnosed at the correct time, their quality of life improves. We can give them a better span of life and a better life which may not be completely normal, but as near normal as is possible. So apart from this, we deal with a lot of asthmas, difficult asthmas. Again, asthma is a very common condition. It is on the rise all over, and even patients who are coming from abroad, like Japan and Korea, it's something which is cutting along across countries. It's so common over there also. So we have this asthma clinic. We deal with asthmas which are not usually controlled with the routine type of medicines. So we evaluate them further, and we have a proper protocolized treatment and a proper protocolized workup for these patients. Spirometries are not a very uncommon investigation. It is done in many centers, but definitely over here everything is done in a supervised way. And another thing that I would like to point out over here is that asthma, once labeled, anybody can manage, but many times it remains undiagnosed. For example, मेरा बच्चा खांसी करता रहता है, and they will not understand that खांसी is something, it is a manifestation of allergy, or it is asthma. So recognizing such children and giving them a diagnosis and treating them will really put them on a way of real good normal life, and more importantly a very active life. Because most of these children will lead a life which is, ये खाने को नहीं देना है, and a lot of restrictions as far as food is concerned, lot of restrictions of activity, of sports. They end up not playing, not swimming, not eating ice cream. Discharges again, it means if the eyes are sticky and if they are having a discharge, it means infection or conjunctivitis in the medical terminology. Again, in the holiday season which is going on, children are going to the swimming pools and they're playing, so they will transmit the infection from one person to the other. So one needs to get a checkup done, and antibiotic drops are usually prescribed, and then it will be